Hi, everyone. In this segment, I'd like to talk about changes in personality or issues that you may encounter during your loved one's decline. It could be anywhere from using language that they wouldn't normally use, changes in sexuality, they may become kinder or gentler, they may actually have physical issues such as seizures. Anything is on the table during a cognitive decline, and depending on specifically which dementia your loved one has. Now, again, I am not a doctor. I have had no medical training. So if you see these things exhibited in your loved one, please reach out to your doctor, your neurologist, your primary care physician, and let them know what you're seeing for changes in your loved one so that those changes, if need be, can be addressed. This part is going to be a little sensitive in nature. Stephanie's issue or change that came out as she was declining was aggression. Now, Stephanie was always very capable, very protective, and able to defend herself, but she was never aggressive. And this came out in her as her cognitive decline started. And it wasn't immediate, it happened over time. Something you should know is that as this was occurring, I was actually three different people. I was Dale, the one who was doing all these things to her that she didn't like. And I'll get to that in a second. I was also Dale that was in the Navy. But then I was also Granddaddy, the one who loved her, protected her, and took care of her. The other thing was that she was convinced at the time that she was not married. And she said that we don't do that in my family. And for some reason, she got the impression that people at church were married to more than one person. So there was a lot kind of going on at this time when the aggression came out. Well, the aggression came out, though, primarily based on modesty. Stephanie was always a very modest person, which of course is a great thing. However, when you're caring for your loved one, everything that you do for them, whether it's taking them to the potty or giving them a shower, uh, getting them dressed, undressed, just trying to keep them up on hygiene, keep them clean, it usually has some modesty component in it. And her aggression actually led to several times she would claw me or she would push me and I'd end up falling over. On November 3rd, 2023, I was out for a little respite time to get groceries or do whatever else I needed to do. And my daughter was here taking care of Stephanie. During that time, my daughter was trying to give Stephanie a shower, and Stephanie was not happy about it. Well, she was so unhappy about it that she grabbed my daughter by the hair and forced her head into the edge of our glass shower enclosure, giving her a concussion. At that point, we knew that something had to be done. So we took her to the ER, and she went in kicking and screaming. I was pulling, my daughter was pushing, and she was fighting us the entire way. By the time we actually got into an emergency room, it took 6 people to hold Stephanie down, including myself, to get her restrained and to get medication in her that would cause her to calm down. At least we were there. And I felt like something could be done. I didn't know what. I kind of assumed that it was going to be meds, and that's what it was. And over the next 13 to 15 days, we were in the hospital and they were working on meds, but it wasn't an immediate response. As a matter of fact, during the time that we were in the hospital security was called in twice because Stephanie was acting out so much. But over time, the meds really kicked in, helped with the aggression, and I was able to bring Stephanie home, which is where I wanted her. I did not want to place her in a facility. I wanted to care for her at home. I wanted her to be with me at home. So some of the meds, well, a list of the meds that they used were olanzapine, also called Zyprexa, Aricept, also called donepezil, and fluoxetine, also called Prozac. She was already on Seroquel, also called quetiapine, to help her sleep at night because she would just get up out of bed and wander around pretty much all night long, and neither one of us were sleeping. As I said, the impact wasn't immediate, but over time, it took effect, and we were able to come home on hospice care as we came out of the hospital. Fast forward to present time. Because of Stephanie's decline, I have felt that we would be able to wean her off of the majority of, if not all, of the medications that they put her on in the hospital. So she is no longer on the Prozac. She is no longer on the Aricept. And we are currently weaning her off of the olanzapine. And we'll see how that goes. Now, she doesn't exhibit aggression anymore, even with the reduced meds, and as we continue to reduce them. She sleeps well at night. She sleeps anywhere from 13 to 15 hours. 13 and a half to 14 is usually a good average based upon the Seroquel that we give her at night. One of the things now, though, one of the issues now is that she does a lot of leaning forward or leaning to the side, things like that. And if you sit her down and you try to upright her, she feels like she's falling. So she can be on the potty, and I just try to gently push her shoulders back so that she's sitting upright, and she'll start going, Dale, 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 as if she feels like she's falling. Same thing in her wheelchair or on the couch. She feels like she's falling. That's just one of the current issues. That's certainly no big deal whatsoever. But I do have to remind her that I've got her, and that I won't let her fall, and that I'll take care of her. So those are just some of the issues that we have addressed. I listed some of the issues that you might face over time. There are tons of things, and I just recommend that you go online and see, based upon your loved one's dementia, what you might experience over time, because it's wonderful to be able to anticipate the things that could happen, the things that you might have to face. Physically, these things, I talked about seizures. Stephanie has had several seizures. They're not common with her, but she has had several over the last 15 to 18 months. That was something initially that was very traumatic for me to see. But I learned very quickly to overcome that, the physical aspect of it, and to address her needs and to get her through it, which usually took about 35 to 45 minutes before I felt comfortable enough to be able to lay her back down and know that she was going to be safe. But with the seizures, I have found that a few hours later, I find myself crying. And why is that? It's because the love of my life, was exhibiting behavior that was just so foreign to me, that was traumatic, that broke my heart to see her having to go through these seizures. So try to prepare yourself to take care of these issues physically. Remember, the disease is not your loved one. Separate the two. It took me the longest time to do that. But separate the two. Care for your loved one. Deal with things that you have to deal with from the disease. Care for your loved one and love your loved one. Let your love grow for your loved one as you show her or him how much you care by being their caregiver. May the Spirit give you strength on your journey. I'll see you again soon.